Hi, everyone. It's Dr. Latowski. How are you? Thank you for joining our Friday webinar. We are super excited to just try something new. We're trying this webinar before your Friday plans, family plans, happy hour plans, etc. And this is a really fun topic. Again, a little bit something different. We thought we would talk to you about the new, emerging, and current technologies and techniques from around the world. Over the last year, I've had the opportunity to uh, travel to Barcelona and to Paris and to learn about cosmetic techniques that are being done internationally. And it's been a really, really positive experience. So I wanted to share with you some of the things that I picked up, and then we'll do a live demo today. So like I said, I went to a summit in Barcelona in November, and it was sponsored by a company called Merz. Merz is a company that owns a product called Radiesse. Radiesse is it's called a biostimulator. It's like a filler, but it also stimulates collagen. You see the results right away, but then they also get better over time and they improve the radiance and the glow of the skin. So this summit in Barcelona was something that I was nominated and subsequently selected for. And there are only about 200 dermatologists worldwide that attended. And so it was a really great opportunity to hear scientific speakers, really, really in-depth science. And we did some roundtables, and we also did some amazing networking, which is really useful because you can run different ideas and even patient care issues amongst a bigger network of colleagues. So during the summit, I gained a lot of insight into the science of what people are talking about as regenerative cosmetic medicine. And I saw, as mentioned, some very innovative injection techniques and presented with the most practice-changing publications over the last year. Like I said, it was very science-oriented, which I really appreciated. And it's really hard to even quantify what I've gained from these experiences because it's just every day there seems to be a situation that comes up, and I just think back to things that I may have picked up or learned, or either from lectures or just by interacting with my both domestic and international colleagues. So starting with neuromodulators. So neuromodulators like Botox, Dysport, Daxxify, Xeomin, Jeuveau, those are the current ones on the market, and we are about ready to get several more. And as you may know, in Europe and the rest of the world, they tend to get other products before we do because the FDA is extremely regulated. And so we tend to get those products after they've been available worldwide. And these international conferences are an opportunity to learn about what's out there and what's good and maybe what's not so good. Something I found interesting was neuromodulators can be used to treat these conditions, and they are being used commonly. And I have to say that that I have used Botox and Dysport to treat these conditions, hyperhidrosis, rosacea, and even melasma in the clinic, and it's commonly being used worldwide. So here's some important points. If you're interested or have a friend who's interested in treating any of these modalities with Botox or Dysport, etc., the doses are usually actually pretty low, and they're usually done about a centimeter apart on the skin. And because it's such a low dose, the results might not be as long lasting as cosmetic Botox. Usually, cosmetic neuromodulator can last 3 to 6 months. Here we might see 6 weeks or 3 months, but it's a really, really easy and it tends to be pretty effective way of treating these modalities, especially I found for hyperhidrosis of the face or excess sweating of the face. And this can be done as an as-needed basis. So for cosmetic Botox, we know that consistency is key. Here, for these conditions, if you have a flare, we can use it during the flare. It doesn't have to be used consistently, like every 6 weeks, for example, or every 3 to 4 months. And it can be combined with other treatment modalities, such as prescription medications, laser treatments, et cetera. And kind of the recurrent theme of these meetings and this talk is that multimodality, or using different things to get a better result, tends to be the trend. So we are so lucky at this time point. We have so many different things we can use. And if we kind of combine the different techniques and treatments, we get a better result. So in terms of fillers, there are so many fillers available worldwide, and we're tending to see a trend towards fillers that last longer. And I know from personal experience that when companies are doing filler studies, one of the questions is, how long is this going to last? And that's kind of what we all want to know, right? As a doctor, I want to know that. As a patient, you want to know that. Company wants to know that. How long will these things last? So that can be a good and bad thing. In general, I consider it to be a good thing. If we have filler that lasts a long time, then we can use a patient's budget to use other modalities. So again, incorporating this multimodality approach to get an even better result. So in general, filler will last a year. There are some fillers that last 2 years. For example, Voluma is a filler that's been FDA approved for a while now, and it will last for 2 years, and it's great for facial lift, and especially in the cheek. A lot of patients have been asking about the press in the last year, that fillers sometimes, I think it's kind of leads readers to believe that fillers might never go away, that they can make the face heavy and kind of do the opposite of what we're trying to do, which is make someone look better in a very natural way. I don't tend to agree with this. I think you can see that result when the filler has not been placed properly or when there's been too much filler done. But if the filler is done and in a proper technique and at a right frame of time, you will not have that effect. And filler is a really, really integral part of our anti-aging journey, in my opinion. So one thing in this Barcelona summit that I picked up a lot of tips on nose filler. And it's a really great way to change someone's face with a small amount of filler. And this can even look like they've had a surgery done afterwards. And you'll see this advertised a lot, if you will, or see it published on Instagram or other social media channels as a liquid nose job. And it really can impact someone's facial shape and structure. So here are a few examples of some liquid nose jobs that I have done in the office. And while I was in Barcelona, I was able to hear a lecture and review a publication by someone who does almost exclusively these all day long, every day. And there's some really innovative techniques on how to actually lift the tip of the nose, which is really desirable because as we age, just like everything else, the tip of the nose falls. So that's been one fun thing that I have incorporated into the practice. Radiesse, I mentioned earlier. It is something that is both filler and regenerative. Regenerative meaning it stimulates your body to regenerate collagen and elastin and possibly other things such as proteoglycans to make us look younger. So Radiesse is FDA approved. It's been FDA approved and available in the US for a long period of time. So it is classified as a biostimulator. So that means it is stimulating your body to produce collagen. However, I think of it as part filler too, because it gives this immediate volumization and contouring. And so it's kind of like the best of both worlds. And it's a really great product. It's made up of something called calcium hydroxyapatite. And you can see a picture description of it on the right. It's calcium hydroxyapatite are these little spheres. And when these spheres make contact with our collagen, it actually stimulates the collagen to produce. And like I mentioned earlier, produces elastin, which means the skin becomes more elastic. And it can even stimulate other components of the skin that make us more youthful. It's very versatile. I love it in the face and off the face. So it can be used for the cheeks. It can be used for the jawline. It's really effective in the jawline to pull back on the face so there's less jowling. I love it, love it, love it for the neck. It can pull back on the turkey neck, and it's great for hiding the tendons and veins in the hands. Great product, and the results just get better with time because of the collagen stimulation. So here's some examples from my clinic. This is someone's neck before and after. This is a very conservative treatment, but even with one syringe of Radiesse, you can see that the texture and the necklace lines are improved, and they will continue to improve over time as that collagen is regenerated. Here is a patient who is very young and beautiful, but we treated her cheekbones, and we treated her jawline, and look how that just contoured her face. It makes her cheeks kind of just pop. It makes her face look slimmer and more contoured and more youthful, more beautiful than she already is. Here's a side view. We wanted, she's of the, she wants some beautiful definition of her cheeks and contouring. And so we did that. And also we really pulled back on her lower face and enhanced her jawline. Here's a male. And so we did a multimodality approach for this male. So we did this product Radiesse in his jawline, and I did something called Sculptra in his cheek. So that Sculptra also stimulates the collagen. And then I did a little bit of Botox for him, and I did some filler in his cheekbones. So this gentleman is very athletic. He does tons of training. He's always on the trails running or doing some sort of obstacle run course, and very, very thin. So he got a lot of tightening with the treatment. Here's another Radiesse before and after. You can see she's had extensive weight loss that resulted in some lines on the left. So we did this Radiesse, we did Botox, and then on the right, you can see she's absolutely refreshed. She got nice lift of her cheeks. She's got softening of these nasolabial folds of the marionettes. Looks completely natural. She looks 15 years younger, and just everything looks softer. Here is a gentleman who is very athletic and fit. And in men, we like to see the cheeks very strong and the jawline very defined. And so that's exactly what I did. I put the Radiesse in this area, and that in turn makes him look more youthful, more masculine. Here's a side view. You can see the definition of his jawline. You can see the skin is tighter, and that makes him look very youthful. I also attended IMCAS Paris. It's an international meeting with over 20,000 dermatologists, plastic surgeons, and cosmetic physicians, from all over the world. It is one of the most prestigious dermatology conferences, and I was lucky enough several years ago to present some of my research there. This year, I was not presenting, and that translated into me relaxing and enjoying and learning as much as I could from the wonderful lectures that were there. One example of one of these lectures is this gentleman who has published on this happy face technique, which results in a Mona Lisa smile. So this is a technique that kind of improves the marionette line technique that we've already done for years and years. So this is one of the common areas people want to improve. This technique is basically going in a different way and breaking up the connections of the muscle to the skin, and it allows for the filler to really fill in and be super soft. And this is something that I've started incorporating into my practice. I've noticed even better results with less filler than what we've been getting. And this is an example of, happy face. It was kind of sad at rest. Now it looks happier. Mona Lisa smile. I did the top here. I also did the bottom, and you can see she just looks happier without looking artificial. Also hot off the press, men love lips too. This is Brad Pitt, not my work, but it's an example of how men are coming in to get lips done as well. And I've been doing this in practice and really, really loving a nice subtle results for men's lip. The technique does differ slightly for men than women. And it's just been really fun to incorporate this into the practice. So here's some before and afters for neuromodulators. This is Botox or Dysport or Xeomin. And then finally, Sculptra was a huge topic. Sculptra is something that has been around forever. It's been approved in the US for over 30 years, I believe. It's been FDA approved for cosmetic use since 2009. This is a product that is also a biostimulator. It stimulates collagen, stimulates elastin, and it will lift the face. It will volumize the face, and it also contours the face. It actually can make the lower face look slimmer, even though it adds volume. And this is something that was really talked about at the meeting because of the recent FDA trials, and we were involved in these trials. There's been this new onset of training and education surrounding this product. And so it's having a resurgence in popularity amongst my colleagues. And so this is widely talked about at the meeting. And it happens to be one of my most favorite products. So I've been using this so much since 2009, and it's really a great product. So FDA approved, it's biostimulator, it restores structure, it replaces lost volume, it lifts, it contours, and all these things are done using different techniques. So you can see in this before and after, my before and after on the right, you can see her skin is kind of crinkly on the top, and then it's smoother on the bottom, but she still looks completely natural. And do you see how it looks brighter? It looks rejuvenated, it looks healthier, it's got a little glow. That's because of the new collagen and new elastin that are being stimulated. And anytime we stimulate collagen, it gives the skin a glow. So this is going to apply to lasers, it's going to apply to Sculptra, that's going to apply to Radiesse. So you get the Sculptra glow, you get smoothing of the skin, and here we've got some nice contouring of her skin while completely maintaining an age-appropriate look for her. Again, Sculptra can help crepey skin, as you can see in that photo, and we've done extensive research on Sculptra in the clinic. Some wonderful before and afters, and you can see how it can just really soften someone's face, especially someone who's very thin and athletic. You can see that beautiful soft results, the lifting, and the improved texture of the skin also because of the collagen. Finally, what's new in technology? Well, there was nothing earth-shaking, I should say, groundbreaking in terms of the technology. But what we are seeing is that more and more people are combining these technologies to get even better results. So here's kind of what my pearl coming away from this. For patients, there are so many things out there. Your view is probably there's so many things out there. I'm so overwhelmed. Which one should I pick? Or should I just give up and not do anything at all because I just don't know what to do? And so my advice to you is take advantage of our services or your established dermatologist or injector. We are here to help educate you, guide you on the best treatment, whether it be one of the things I've already talked about or devices. And we can customize this for your specific goals. If you have an event coming up, if it's a wedding, if it's a reunion, if it's just a vacation, we'll customize it for your downtime, your lifestyle, for instance, your sun exposure or your athletic events, and of course for your budget. So all these things work better when we put them together and we combine them, and we end up preventing the aging process, slowing down the aging process. We can't really prevent it, but we can slow it down, and we can do so really quite efficiently with all these tools that are proven to be safe and effective and reproducible or reliable in their results. So all these things are better together, and we can age gracefully. So here's an example of all three products that I have talked about in terms of injections. So I have done a little bit of neuromodulator on her. I have done, and that was on her lower face to kind of soften the tenseness down here and soften the pull of her muscles down. I have done some Radiesse in her jawline and in front of her ear to pull back her skin. And in doing so, we took the gels and redistributed them back here. Because I use that Radiesse, I have also rejuvenated her collagen. So you might see she has a beautiful glow in the picture on the right, even though she's not wearing any makeup in that photo, and she's got beautiful definition in her cheeks. The skin is less heavy on the front of the face, and she looks completely natural. When I saw her at the visit on the right, so not pictured, I also did some Sculptra for this area, which is really going to continue to lift and contour. And her results are going to be very beautiful. But even in this picture, when I was focusing on her lower face, you can see how much tighter her lower face is and how much younger and more feminine she looks, even though I did nothing for her cheeks or her temples. And that was using a combination of neuromodulator, Radiesse, and I also used a little bit of filler right in here to soften these creases. When I saw her back on the visit on the right, not pictured, I did Sculptra in her upper face to further lift and soften her upper facial features. Thank you so much for sitting through this. Here are our promos for you. And so we have 3 levels of promos, level 1, level 2, and level 3. And these are designed to give you this complementary results. So when we use multimodalities, you get an even better result. So level 1 is one treatment of neuromodulator. So that could be Dysport, that could be Botox, a limit of 60 Botox units. So in our clinic, that would be up to 180 units of Dysport. And 1 syringe of the Radiesse. So that will give you some instant results, but that will also stimulate your collagen and give you a nice glow. And 1 vial of Sculptra. Sculptra will develop over 3 to 6 months. It will give you volumization and contouring, and it will give you extremely long-lasting results. So we are layering all these things to give you a really beautiful, long-lasting result. We are offering that for $2,000. The value is $2,800, so you're saving $800 by purchasing that. The second level is the neuromodulator, the 1 syringe of Radiesse, the 1 vial of Sculptra, and 1 syringe of hyaluronic acid fillers such as Juvederm, Restylane, anything that we decide together is suitable for you. For instance, we could do your lip lines, the barcode lines, and fill those very, very softly and very naturally. We could do your lips, we could do these folds, or we could do the happy face technique down here for the marionettes. So we have options, and we can customize this completely for you, but this gives you an opportunity to combine the modalities for a promotional price. So the promo cost is $2,600. The value is $3,600. So you save $1,000 on that. And finally, the level 3, it's 1 treatment of facial neuromodulator, 2 syringes of Radiesse, 1 vial of Sculptra, and 2 syringes of hyaluronic acid filler. So you save $1,500 by purchasing this. You will get an absolutely beautiful result, and this allows us to do a lot of work that will still look subtle, age appropriate, yet impactful, and will be long lasting for you. The promo is $38.50 for that. And so please call our cosmetic number today, or you can, and we will post the cosmetic number here, or you can email us. We are extending this offer just through the end of the day. I know it's kind of the end of the day already, but we do ask that you commit today because of scheduling availability. So now we're going to do the demo, and I'm going to do a short consultation as I'm doing the demo. So that's something that we sometimes don't do live. So I really want to do that for you live today. And then I'll discuss how we will use multiple different modalities to treat our patient. And then we'll do some of the injection on camera, and I'll probably just finish up off camera in the interest of time. So thank you again so much for taking your Friday afternoon to spend with us. And really hope you enjoyed this up-to-date kind of update on cosmetic dermatology. And I hope you enjoy the promo and the live demonstration. I'm going to pause, and then we'll turn the camera back on once we've turned it around. All right, guys. We are back. Thank you so much for coming in. And I just wanted to say our cosmetic number is 480-651-4989. And we also posted it in the chat, and we posted a link to the specials as well. We are going to do a live consultation here and see what she's thinking. Can I grab a mirror for me, please? So Jenna has had things before. We've done Fraxel before, but it's been a while since we've done any sort of like lifting or filler. I mean, years probably, right? Yeah, and we've done Sculptra.
But no fillers.
Maybe Sculptra like a year ago, something like that, or six months maybe. So, but no fillers for yours. And let's see what you're thinking.
Okay.
I'll give that to you. So when you look in the mirror, what are you seeing that seems like it's like different than it used to be, or it kind of bugs you when you look in the mirror? What do you see?
Definitely have some joweling. I feel like some redundancy here.
I would call those baby jowls, but yes, like a little bit of baby jowls, like right in here. Okay.
And then I feel like I've lost some volume here.
Okay.
And that my upper lip is just a lot longer than it used to be.
Okay. Okay. Excellent. So I love everything you just said. And this is something that universally affects us. We want to take this little redundancy here. We want to put it back to where it used to be. So for Jenna, I notice that her cheeks want the volume. So rather than pulling back, when I pull back, I get a little bit of movement, but I'm really getting more movement when I go up. So I think her cheeks could use some volume, maybe a little bit of volume back here and a little bit of support of your cheeks here. As time goes on, our apples of our cheeks tend to come down, presses on this little line here and deepens the crease. And if we just support this area, we don't even have to make the cheeks bigger. If we support this area, it will lift. So it'll lift from down here, it'll soften this crease, and it even rejuvenates the eyelid area because the cheek's not pulling down. And then, so when I also do this, it will also lift the lip up a little bit too. Okay, so let's do it. So I think you've responded really well to Sculptra in the past, which is why, we've used it. I think that's a great option for this area. However, if you wanted to use a little Radiesse in your cheek, that would give us some quicker results. So we could do a combination of some Sculptra here and here for some long lasting lift. And then we can do this area for some really nice, firm and instant pulling back. Does that sound okay?
I love that.
Okay, great. Perfect. All right. So she's been numbing, but that's it topically, I think, right? But that's it. So go ahead and rest your head back. I'm first going to inject a little bit of lidocaine into the area where I'm going to use a cannula. I always use a cannula for most of the cheek area because it's considered to be safer for injection techniques. And I can also get away with less needle sticks. So this is something that kind of can look a little unsettling, but it actually is not when you're the patient. It feels just kind of weird, like some pressure. And like I said, it's actually gentler because it results in less needle sticks. We use our trusty AccuVein, which lets me see the more superficial veins and therefore avoid them. Can you go right up in here? Let me just see. Here, good. Okay. And now I'll inject a little bit of lidocaine. So here we go. Pinch. Great job. This just kind of makes those first injections easier. Both Radiesse and Sculptra have lidocaine within them. And so here's a little pinch. The injections actually get easier as time goes on. And the face becomes numb and it literally just feels like pressure. 1-to-1 with the Radiesse. So I will start with the Sculptra. And so you'll just feel some pressure. She's not going to feel any discomfort here because I've injected that lidocaine. Thank you. Do we do hypochlorous? Okay. So her skin is also prepped right now with hypochlorous acid, which is it's actually a derivative of bleach, but it's a very effective cleanser for the skin. And it's still gentle enough to use on the face. And that helps keep the area as clean as possible. Here we go, my dear. A little pressure. I'm going to do this injection that will support her cheeks. Great job. And this also lifts the lip too. Great job. Got very tough skin. This is kind of our chronic joke. She's got very, very tough skin. Back before I was using cannulas and I was using needles, she would always dull the needles when I was working on her. We just have this constant joke about that.
Yeah.
Yeah, it's ongoing. Okay, relax for me. And a little bit more over here, little pressure. Great job. You feel okay? Great. Okay, so let's see how that looks. Beautiful. Great. Nice and soft. Now turn away from me, please. And just wipe that for me. Just go ahead and wipe off the purple. Thank you. Thank you. All right, now I am going to do a little bit of enhancement of her cheekbone. There's a little pinch, Jenna. You'll feel this a little bit, sorry. One thing I forgot to mention about Sculptra is that it actually has been shown to prevent bone resorption. So I like to inject the Sculptra right on top of the bone because that will slow down the rate with which the bone goes away over time. And again, this kind of looks a little bit more traumatic than it is. She's probably just feeling pressure. And you notice I can treat basically this whole area with just 2 little injection points. So there's that. Pressure, please. Great job. And then now smile for me, Jenna. Great, relax. A lot of people, especially on the left side, get some sun damage right in this area. And this Sculptra, because of the collagen stimulation, can actually help to reverse that sun damage, that texture change we get from sun damage. So I am going to do a little bit of Sculptra in that area, not really for volumization, but for the texture change. So this is going to improve the health of her skin in this area. See if that first syringe is ready. Here. Wonderful. Awesome job. Okay, so that is basically like a little less than 1/3 of a vial of Sculptra. So you can see that we can really do a full face rejuvenation, even with just one volume or vial of Sculptra, because we've used less than 1/3. And yeah, are we looking? Yeah, look at her like side to side. You can see that her cheek is just higher on the left side where we've treated, and everything's just kind of lifted and more contoured and defined. So her whole face is lifted just by using a tiny bit of Sculptra in that area. All right, go ahead and lay back. Great job. So Sculptra, like I mentioned, builds up over time, and it will, it's a little, you know, it has a little bit of swelling right now, and that helps us see what the results are going to be. And then over time, you know, so you start seeing the results usually in 3 or 4 weeks, but really 3 to 6 months, you see that the skin looks healthier, and then that that you get volumization and lift. Okay, so Okay, so this is Radiesse, and it's a more opaque material. It's made of that calcium, those little calcium spheres that I showed you a picture of. And it's a really, really fun product because it can lift even the heaviest skin. Men kind of have heavy skin that's thick, it's heavy. If it's really saggy, it's like you need something with substance to lift it. And also that's why I like using it around the jaw, because it can really pull a lot of skin back with just a small amount of product. So it's really fabulous. Because it also stimulates collagen, it lasts for a long time, and it also increases the healthiness of the skin. Great job. How you doing, by the way?
Great.
Okay. Pretty numb?
Mm-hmm.
Good. So again, sometimes this looks a little bit more traumatic than it actually is. And it's usually, for most patients, pretty easy process, especially when I have my amazing assistants here, because they just make it so easy for us, and they do such a good job numbing and helping me out here. Okay, so let's take a look here. I'm going to just massage a little bit, put your head back for a second, and massage it into place. Right. How's it feel?
Good.
Good. Okay, and go ahead and flip forward. Let's take a look. Beautiful. Okay, so you can see, I don't know if you can see the side to side. You can see that her cheek is much lifted over here. And she's got some pull back over here on this side, versus this side seems flatter, and this area seems heavier. Beautiful. Okay, go ahead and rest back. Now, did you want to do a little lips or? We're gonna do lips. Okay. Hold pressure here. Okay, perfect. Are there any questions so far on the webinar? Okay, great. Do your lips feel numb, Jenna? Okay, great. Okay, so the lip filler I'm going to use for Jenna is called Redensity. By the way, that was half of a syringe of Radiesse. So again, you can see we're doing a full face treatment with probably a total of 1 vial of Sculptra, 1 Radiesse, and then 1 syringe of hyaluronic acid for her lips. So she's going to get total rejuvenation with those 3 things. Okay, and she looks very happy about it. Nicer lower lip, please. So we'll get that area nice and cold. Lips are more sensitive, but they're very doable. It's just like 1 tiny little pinch, and then after injection, all the discomfort is gone. They will be swollen, depends on the product we use, but usually 3 to 7 days. And there is chance of bruising, although they don't always bruise. All right. Okay, now relax your jaw for me. Good. Yep, perfect. Great, open. And then here we go, little pinch. Great, you'll feel the filler going in there. Beautiful. And again. Amazing. Doing okay?
Mm-hmm.
She's so great. Amazing. Great job, Maya. Pressure, please. So this is a product called Redensity. It will, it's hyaluronic acid. It will make her lips look very hydrated. It will make them look plump. It doesn't add a ton of volume, but it will add structure, plumpness, and hydration to her lips. And it's a really gorgeous, natural looking product. It's one, like if someone comes in and they say, my significant other absolutely cannot find out I'm doing my lips, I probably would choose this product because it's just so natural looking, doesn't swell very much. Okay, we'll do the top one. Open slightly. Good. A little pinch. Top lip's a little bit more sensitive, sorry. Great. And pinch. And last one here. Good job. Beautiful. Okay. So that's about half of a syringe and half of her lip. So let me just mold it here a little. And I don't know, Johanna, if you can get close where the audience could appreciate the hydration of the lip, like one side to another. So again, you can definitely tell this side is lifted, pulled back, and then her lips are more defined and more hydrated on that side. And close your lips, okay? And can you get a little closer to her lippies? There we go. Perfect. All right, Jenna's like, no more, don't get too close. Okay. All right, guys, thank you so much for tuning in. I absolutely love doing these webinars with you. So thank you so much for listening. And if you have any questions, please let us know, give us a text or an email. And I look forward to seeing you soon. Thank you.